My name is Dr. Mohan Keshavamurthy, Principal Director, Fortis Hospital, Bangalore. We have now come up with a revolutionary concept of patient-centric OPDs to address specific clinical issues in urology, urogynecology. The first of which is biggest single social problem across age groups, which is leakage of urine. We call this the Incontinence Clinic. We have specific packages consisting of a battery of tests, consultations, specialized investigations for the pediatric age group, for the man with the problem of incontinence, and for the woman with the problem of incontinence. Incontinence can be of a variety of causes. It could be urge incontinence, you can't hold the urine till you reach the bathroom. It could be stress incontinence, if you laugh or cough or you get up from a sitting posture, you leak urine. It could be overflow incontinence, wherein you leak urine unknowingly because of an obstruction to the urinary tract, typically because of prostate hypertrophy in the elderly, or it could be neurogenic incontinence post-stroke, post-recovery from any major illness. You might have a neurogenic incontinence, or it could be because of an unanatomical connection, maybe post-surgery, between the vagina and the bladder, or the vagina and the urethra. So this particular incontinence clinic, which we have come up with as a single stop solution for any such problem across age groups, is called as Incontinence Clinic. This is the one of 4 specialized clinics that we are coming up with to help patients in a way where a definitive solution can be found for a difficult problem. Thank you.